Hi, Peder Stokke is here again. In this module you will get an understanding of what's behind the scene of the technology and why we don't use everything that are on the market of video communication services. After you have been through this module, you will be able to tell why we use only a handful apps for video communication, what's the differences between network, and why it's so important that we follow rules and regulations. In this module there will be a lot of new terms. This will be explained consequently through the chapters. We will start taking you through video communication apps. Secondly, we will show you how this is connected together. And at last, security. Why every app is not used in telemedicine, and how and why we work to be sure we use the right tools for the job in the right manner. In order for digital communication solutions to work, we need a digital device, i.e. PC, phone. We need an app that can be used to communicate with on this device. Then the app must have a service that link the apps together. There are a number of services and service providers out there. You've probably tried more than one of these for personal use. Most of these services are widely available. These are providers that are extremely large, have millions of users from all corners of the world, and therefore have several servers all over the world. It's a challenge, as in patient communication. We need to be sure where the information goes and be confident in how it's processed and stored. That's why only a handful of services are used in video communication in healthcare. Here are examples of some that are being used in healthcare. It should also be noted that it's rare for a healthcare service to use more than 2 different solutions at the same time. Most use only one solution. Some of these providers, such as Pexip and Confrere, specialize in delivering secure services, especially for the healthcare sector. WebEx, Teams, Zoom and Whereby have made it possible to use their services in a secure and documentable way. Some healthcare services use these for patient communication. You will learn more about this in the chapter on security. Network. In order for apps and services to be utilized, we need a digital network to keep things connected. In this chapter we will go through the most common networks and explain the differences in technology and areas of use. Basically, we can distinguish between 2 different basic technologies. Wired networks, where one needs network cables to make it work, and the other is wireless networks that use radio signals to transmit their information. Here I will go through only the basics. Ethernet is also known as WAN or LAN. WAN, Wide Area Network, is like network between companies, healthcare organizations and homes and others, also known as the Internet. LAN, local area network, is networks within companies, healthcare organizations and homes. Both WAN and LAN networks were originally fully or partly wired. Today, Ethernet is used as a term for the wired networks. Wired networks are mostly used where high stability and high speed are required. Devices that are normally connected through Ethernet are desktop PCs and dedicated video devices. Wi-Fi is a wireless network for shorter distances. Most digital solutions can utilize this type of network. Today there is little to distinguish between wired and wireless networks. However, there are many devices need to connect to networks at the same time. A wired network will be able or always provide higher speed and more stability than Wi-Fi. A rule of thumb is that wireless networks, the bandwidth is shared equally between users. One user full speed, two users half speed, and so on. Our mobile phone network is more than just a phone network. Like Wi-Fi, they give us the ability to send and receive data. These networks have evolved over decades and generations to provide us with high data speed and stability, high enough to make it possible for unlimited video calls anywhere, anytime. The beauty of this network is that it gives us freedom we don't otherwise have with wired network or Wi-Fi. We can use telemedicine services, as I said, anywhere and anytime. As long as I have data left on my data plan, and of course there is coverage. We can connect almost everything directly or indirectly through 4G, but mostly handheld devices utilize these today. To the naked eye, 5G, the next generation, is almost the same as 4G, only newer, has a little more speed, a little less delay, but it has a lot of new functions. I could say a whole bunch, but most of these services we will never see or need to use in our daily work. But those that can be useful are more things can be connected to 5G that would normally have used Wi-Fi or Bluetooth. Things that run on battery can connect without using power continuously. It saves power. Where a lot of data is needed to be sent in a short period of time, it gives us higher speeds. In this example I show here, the monitoring of medicine pump at a patient's home is going to be more frequent to see. Patients are not only entitled to the best treatment at all times, but they are also entitled to privacy in relation to everything that happens to them. This means that only the person or people directly involved in the treatment have access to information about the patient that is directly relevant to the treatment. In this chapter on security, we will look at why and how this is and should be ensured. If we assume that the patient is using video service that may be available on our mobile phone, such as Google Meet or FaceTime. This service could in practice be used to communicate with everyone. For example, her daughter, her husband, children, or even her GP. However, because her GP is required to communicate in such a way that they can document that no information goes astray, the communication solutions must be a solution that they can vouch for. Therefore, the solution that the private individuals use are not used in most cases. Technically, a connection between the patient and the doctor takes place as follows. At a specified time, the patient and the doctor connects to a shared video conference room. A server at the service provider connects these two apps together. This connection is made through several firewalls that you see here that secure the service provider, the doctor's workplace, against hacking, and most PCs, tablets and phones also have this capability built in. On top of this, the app itself ensures that nothing is being intercepted on the road by calling it. It's called end-to-end encryption. Service providers of video solutions and almost all other types of data solutions currently use what we call cloud solutions today. The idea behind cloud solutions is that they utilize computing power and storage space wherever there is capacity and space, and not necessarily in the same place every time. This means you don't know where your data is or going. Only the service provider's records have that overview. Because many countries have requirements for accessing data stored in the country, or where it's uncertainty as to how securely the data is processed or stored. Not just any cloud solution can be used in healthcare. According to the EU regulations, the cloud solutions must therefore be stored in an EU country or a country that is linked to the EU and follows the same rules for the General Data Protection Regulations, also known as GDPR. The principles mean, among other things, that you must have a lawful basis under the GDPR to be able to process personal data. You may only collect personal data for a specific, explicit, stated and legitimate purposes. You are not to process more personal data than is necessary for those purposes. You are to ensure that personal data is accurate. You are to erase the personal data when it is no longer needed. You are to protect the personal data against unauthorized person or against getting it lost or it getting destroyed. And you have to be able to demonstrate that you live up to these rules in the data protection regulation. I hope you are now left with an understanding of how things are connected together, why we have to work the way we do, and what opportunities there are now and in the future. One thing is certain: telemedicine is here to stay. Bodil Helene Bach and I wish you the best of luck in your education in healthcare and welcome you because you are needed. Thank you.